The purpose of this procedure is to provide sterile drainage of effluent out of the peritoneal cavity and the installation of dialysate solution into the peritoneal cavity. The continuous ambulatory peritoneal dialysis, or CAPD prescription, is ordered by the physician and includes the volume of the dialysate exchange, the number of daily exchanges, the type of dialysate solution, either glucose-based, icodextrin-based, amino acid-based, or bicarbonate-based. Peritoneal dialysis training nurses, Deer Lodge Center peritoneal dialysis trained nurses, and virtual peritoneal dialysis unit nurses may adjust the dialysate solution strength based upon patient assessment. All other personnel must have a physician's order signed by the nephrologist to adjust the dialysate solution strength. All RNs and LPNs who have received education and training and who are competent may perform this procedure. The following equipment will be needed for this procedure: twin bag dialysate solution as ordered, or per Nursing Assessment Policy Statement 2. 2 sterile mini-cap packages. Check the expiry date on the package. 2 clean clamps. IV pole. Towel or incontinent pad. Clean paper towels. Perform hand hygiene. Before opening the outer wrap of dialysate solution bag, ensure the correct solution volume, dextrose concentration, solution type, temperature, and expiry date. Remove the dialysate solution from the outer wrap. You can use the corner of the clean clamp to slice the outer wrap. It will not cut the dialysate bag or tubing. The twin bag is steam sterilized, and there may be some residual moisture from that process in the outer wrap. If there are more than 2 teaspoons of liquid in the outer wrap, discard the dialysate solution set. Peel the drain bag and lines from the dialysate solution bag. Hold the patient connector so that it does not become contaminated. Using a clean paper towel, dry the dialysate solution bag. Check the dialysate solution bag for the clarity of the dialysate solution, intact medication port caps, and connector cover, and leaks by squeezing the bag. Add medication as per 3080-03 if ordered. Hang the dialysate bag on the IV pole and lay the drain bag on the towel or incontinent pad on the floor. Ensure the connector remains sterile. Remove the transfer set from under the patient's clothing. Ensure the twist clamp of the transfer set is closed. Perform hand hygiene. Remove the connector cover from the dialysate solution tubing. Maintain sterility of the Luer lock connector. Holding the transfer set securely, remove the mini cap from the set and discard the cap. Maintain sterility of the exposed end. Connect the dialysate solution tubing to the transfer set using aseptic technique. Open the transfer set twist clamp to begin draining. You can tell the drain is complete when the drain line feels cool to touch and no longer see fluid moving in the drain line. Once the drain is complete, close the transfer set twist clamp and apply a clean clamp to the drain line. Ensure that the drain volume is appropriate. Assess the effluent for clarity, color, and presence of fibrin through the clear window on the drain bag. If the fluid is cloudy, do not proceed with the exchange and refer to 60-30-14 peritonitis protocol. Break the green seal on the fill line. To flush the air from the fill line, open the clean clamp on the drain line. Count for 5 seconds. Close the clamp. Do not allow more than 5 seconds to pass to avoid losing too much dialysate in the drain bag. Verify that the air is removed from the fill line and then open the transfer set twist clamp to allow dialysate to flow into the peritoneal cavity. Close the transfer set twist clamp when the dialysate solution has completely infused. There will be some air in the fill line, but there is not enough air in the system to reach the peritoneal cavity. Clamp the fill line with a second clean clamp. Perform hand hygiene. Open the mini cap package with the foil side down so that the cap does not roll off the surface. Position yourself to avoid crossing arms when making a sterile connection. Maintaining sterility of the transfer set end, disconnect the dialysate solution lines from the transfer set and apply the sterile mini cap. Immobilize the transfer set to prevent trauma and infection to the exit site. Measure or weigh the effluent and dispose of per facility policy. Some facilities will require weighing the bag to approximate the volume of effluent. 1 milliliter of effluent fluid is approximately 1 gram of weight. Some facilities will require measuring the effluent in a graduated cylinder. Disposal is usually in a hopper or toilet. Ensure appropriate personal protective equipment is utilized. Ensure documentation on the CAPD or continuous ambulatory peritoneal dialysis flow sheet. Record the volume and concentration of dialysate infused, the clarity, color, and volume of effluent, medications added if applicable. In the patient health record, record any medications added if applicable, or an integrated progress note if the peritonitis protocol was initiated.